28 is reported favorably. Congratulations. Okay, moving on. So we have presentations today on early childhood development, and as I said, that through early childhood development we could stop the cycle of abuse and neglect, I believe, and it's an important tool. And at this point, there was a meeting this summer of the Children's Cabinet, and they took some action. And in your backup, there is a letter from the Florida Children and Youth Cabinet, and I'd like Wansley Walters, who you're very familiar with, who chaired the Juvenile Justice, Department of Juvenile Justice, and is doing a terrific job with our Florida Children and Youth Cabinet. So welcome, Ms. Walters.
Madam Chair, Senators, thank you for allowing me to come here
Is her mic on?
Is your mic on? Is it on?
Oh, I didn't know where the button was. I'm speaking to you today on behalf of the Florida Children and Youth Cabinet, and we have several members here today who may want to weigh in, and so I'll be very brief. I would like to give you just a brief overview of our cabinet. It was created by the Florida legislature in collaboration with the governor to be a coordinating council. The intention for the cabinet is to develop a cohesive vision among the branches of government, develop plans and policies that help guide Florida's long-term commitment to improve child and family outcomes in our state. And the composition of the cabinet is representing the Senate President is your chair, Senator Sobel. Representing the Speaker of the House is Representative Gail Harrell, who is here today.
Yeah, Gail, welcome.
Representing, we also have the secretaries or the agency directors for all the state agencies that interface with children: Department of Children and Families, Department of Juvenile Justice, Department of Education, Health, Agency for Health Care Administration, Agency for Persons with Disabilities, Office of Early Learning, Guardian Ad Litem, Governor's Office of Child Abuse Prevention, and also appointees from the Attorney General, also the Chief Financial Officer, and 5 additional members appointed by the Governor. And there are members here, as I said. To bring you up to why Senator Sobel has asked us here today, it is on August 27th, the Cabinet met and voted unanimously to recommend and encourage the Governor and Legislature to make early childhood a top priority for the 2016 legislative session. It is becoming increasingly evident through research that the first 3 years or the first 1,000 days of a child's life literally determines the quality and potential for the rest of their life. That is for the good and for the bad. As someone who's worked for a long time with the juvenile justice system, I have been well aware that the children who are in the deepest end of our system, the ones that are the most difficult to help, often had the roots of their problems that came from the early years of their lives. And the Cabinet has had an extraordinary opportunity to hear from experts and researchers throughout the state of Florida, and most recently we had a phenomenal presentation at the Cabinet meeting that had us want to take action and get involved in this. But one of the things that I think it's important for the legislature to understand is, for me personally, I always thought that children could make up the deficits that they might experience in the early part of their life. But we're learning that this is actually not the case. For example, you could have 2 5-year-olds start kindergarten together. Depending on the vocabulary and the experiences that that child has had in his early life, they enter school at different levels. Both children can begin to progress in their school education at the very same exact trajectory, but yet the child that has been disadvantaged will never, ever be able to reach the potential of the child that came into school at a higher level. And as a matter of fact, unless it is a truly exceptional child, that gap is going to carry with that child throughout the rest of their school career. So while our cabinet is here today to really encourage you to start looking at the entire array of what is going on in early childhood for children in the state of Florida, we want you to know how critical it is that we invest in that period of life. I'm not here to give you recommendations today. The Cabinet has a policy impact committee that is reviewing programs and services. But we wanted to start this conversation and this concept, and I know there are other presenters here today, but there is virtually no problem in this state that involves human crisis that would not be improved with more emphasis on the first 1,000 days of life. And that includes education, jobs, mental health, substance abuse, crime, violence, and incarceration. So, on behalf of the Cabinet, thank you for letting me discuss an issue that we unanimously support. Thank you so much.
Thank you very much. Just stay there. Are there any questions? Okay, there were no questions. Any member of the Cabinet that would like to get up and speak, please fill out a form and come up and speak for a minute or two, and why you think this is a crucial issue at this particular point.
Madam Chair, members of the committee, my name is Steve Ufelder. I'm a governor's appointee to the Children's Cabinet. I've also served as Governor Bush chair of a mentoring program. I've chaired the Children's Coalition of under the Commissioners of Education. I've been a public defender, which when I first got started with this issue, I learned about this when I was a public defender in Miami. I asked every single juvenile that I represented what their childhood was like, and 99% of those kids that were in the system didn't have the type of early childhood care that we need to do. I really believe in order to save money, we have to spend money. I have been involved in this issue for years. I have sat through committees, I've sat through work groups, I've sat through special committees, commissions. Right now, we have a mayor's commission here in Tallahassee. We talk about the same issues. The unfortunate part of this, none of this is new. We've known this for 30 or 40 years. But how come we're spending $20,000 on people in prison, $25,000 to $40,000 on people in juvenile care? Why do we do that when we're spending 1/10 of that on early childhood care? I think we need to measure the quality of early childhood care. We need to spend the money on it, and we need to spend the time on it. 30% the children entering first grade in this state aren't prepared. That's terrible. And I've stood by for years and testified, been on all these committees, and the issue hasn't changed. It's just the will to change and spend the money we need to spend so that we don't spend it on the end of the process where we put people in jail, juvenile detention, and every other way that we can punish them. So thank you for the opportunity to testify here today, and I appreciate it.
Thank you for your good work. Are there any questions?
I have a question, Madam Chair.
Senator Altman.
And it could have been either speaker, but I didn't want to ask the question too early on. I'm sure everybody has a chance to talk. But when you say lack of care, define that. Is it lack of food, people reading to them? What are the type of deficiencies that these kids are children, infants?
They're better experts than me, but it's the kids aren't read to at an early age. I've got grandchildren where from the first week my children read to them. That doesn't happen in many homes where the people don't have the education and the support. A lot of these kids don't have proper health care. A lot of them don't have, their parents don't have jobs. I'm a guardian ad litem also, and I have I'm guardian for a 2-year-old. And when I first visited that 2-year-old, the father was working all day long, and a 16-year-old was taking care of that child all day. That is criminal. We need to find child care, early childhood education for these children. If we don't, we're going to be spending a lot more money on them.
And a follow-up just quickly. As far as the assessment and the analysis of the first 1,000 days of care, I'm curious about what type of variables and controls are considered in this analysis, because it's only logical if you have a set of parents that don't give the ultimate care to a child the first 1,000 days, they're probably not going to do it for the next 1,000 days. So in the child's ability to rebound, let's say, from not being read to, you know, if they have the same parents, they're probably facing those same challenges right on. Who's to say that if we were to reach them, like in our VPK programs, out of that these kids are lost, that surely there's things we can do to overcome it. I'm just curious about the science on the analysis and the specifics to the type of deficit we're talking about.
Well, I'm certainly not the expert on that. Mimi Graham's here, but I can tell you that these kids that start pre-K and kindergarten, these 30% that aren't prepared, their vocabulary, you know, and I might be wrong on this, 30, 40,000 words in early childhood that's got training. So 10% of that, 15% of that for a child that doesn't have that ability. And if you don't get the momentum in the first 3 years, you don't have the momentum for the future. And I really believe, you know, Mimi Graham's here, and she'll do a much better job on scientific information than I would.
Right.
But I thank you.
Okay. Thank you very much, Representative Gail Harrell, who chairs the counterparts of this committee and does a very fine job in the House.
Thank you.
Welcome. I'm glad you're here today.
Thank you very much, Madam Chair, and I'm here really in support of the Children's Cabinet. As a member of that cabinet for the last 4 or 5 years, I've really been very involved in how we are dealing with our child welfare system in every aspect of a child's development that the state has an impact on. And certainly you can't legislate good parenthood. To your point, I think we cannot do that. But as a state, we spend a lot of money throughout the entire system, whether it is through early childhood education, whether it is through prenatal care for the moms, whether it is through Medicaid that follows that child, perhaps if they are in a low-income group. We spend a lot of money on our children, as we should. This is the most vulnerable population we have. So we, as a state, as legislators, and the cabinet would like us to focus very carefully on the dollars we spent. In answer to your question about why those first 1,000 days, I think the key issue here is brain development. When you look at how your brain develops, and that infant newborn brain is so malleable. 85% of brain development actually takes place during those first 3 years. It's an opportunity we have. We want to make sure that we have, and in fact it starts before that in prenatal care, making sure that we have a good, healthy baby that is born, and making sure that every penny we spend very carefully, thinking about the impact it will have, especially in those first 1,000 days. And that is the focus of really what we want the legislature to look at as we go about every bill we craft that impacts children. So I'm totally in support of the letter. We were there. Representative Sobel was there, and Senator Sobel. We were representatives together back in the old days in the Florida House. But, I would encourage you in every piece of legislation that comes before the legislature that we consider that, the impact, especially during those very formative first 1,000 days. Thank you.
I just want to clarify, my question or statement wasn't that we can't legislate good parenthood. Actually, I think we can do things legislatively to encourage good parenthood or training or whatever. And it wasn't really a question why those first 1,000 days. My questions were specific to what are the specific things that are being deprived of the children, whether it's food, physical contact, physical activity, lack of reading. So what are the specific things that are being deprived? And secondly, when you look at the longitudinal studies, first 1,000 days, second 1,000 days, third, how are they controlling? If the environment's the same, those kids are continually going to be behind. It was more the control factors and the science. Those are the only two questions I had. But no, I'm with you. I can see the importance of those 1,000 days and why we need to do something. I'm just curious about what's the science behind it, and if we're going to address this issue, how are we going to target the specific behaviors that we need to target to ensure these children are okay?
Madam Chair. Yes.
Representative Harold.
In answer to that, I think we need to hear from some of the experts, and Mimi Graham from FSU has really done extensive research on this. I really believe that when you give that jump start to a child, you really are building for future. And yes, you have to continue it. You want to make sure it starts there, but you don't let it stop either. So we need to make sure that the programs we put in place cover those first 1,000 days. And you're talking about prenatal care. You're talking about early intervention in learning disabilities. When you can identify a child early, you have much better chance of dealing with disabilities, be that a variety of disabilities. It's making sure when they go to a daycare center, you have high quality daycare centers, and especially for our children in the child welfare system who are already behind the 8 ball, that we make sure that when they are placed in a foster care home, in a foster situation, that it has that is the very best placement for them. So there's a variety of things that we can do legislatively to make sure that we are giving that very malleable brain, that young infant, the best opportunity in life.
Thank you very much. Alan Abramowitz is on the council as well. That's the Guardian Ad Litem program.
Thank you. I'm the
Welcome.
Executive Director of the Guardian Ad Litem program. We heard the presentation, and my name is on the letter too. I was very proud to vote with the other members to support the first 1,000 days. And afterwards, I went back, had the presentation sent to my people that are working on our legislation, and we tried to look at all our legislation in relation to the first 1,000 days and amended some of our budget requests involving that, including the goal to try to get certification for our people that support the volunteers in training and understanding the first 1,000 days, and also ensuring that we're on children the first 1,000 days of life that are in home but abused and under court jurisdiction that we are not at this point funded for. So we took it very seriously. I think the other agency heads are too. I keep thinking of the first time my mother at Guardian Ad Litem took a case. She's from Brevard County, and she called me up after it. It was first case. She goes, "I can't believe I got a 2.5-year-old doesn't know their colors." Now, my mother's an artist, so the child knows their colors now, so we're good there. But I think this is very important, and Mimi Graham really had an impression on me when I heard the training, and our staff are going to be trained in the first 1,000 days and how big an impact it is. Thank you.
That's great. That's great. Any questions? Okay, let's hear from Mimi Graham. You want to? Sure.
Just thank you. We have someone else that's going to, Mimi Graham's going to speak?
Yeah, we're going to have the professor speak.
Right,
Who did the but I know you have some good insight, and you're going to help lead us to the answers. I think you will. So, all right. Welcome, Professor Graham. Everybody's waiting to hear your presentation. She has lots of resources. If you have any questions about proof that her ideas are valid throughout the country and internationally, her findings are validated. So,
thank you so much, Senator
welcome.
Sobel. Thank you. I'm not sure if you want me to address the first 1,000 days in the presentation or go into the quality child care.
Well, I think we should look at the opportunities in the Child Development Block Grant, because that was just renewed. You have something on that, and why this committee and how this committee can be helpful.
Great. Well, first of all, we're very excited by the enthusiasm about the first 1,000 days. And are you Claude? Could you put up the presentation, please? Okay. And to answer your question, there are studies that have been done that started at age 5 and didn't get nearly the same results than when you started at 3, and that didn't get nearly the same results as when you started at 2. And so we know the earlier that you start, there have been several longitudinal studies that have shown that it really makes a big difference if you get there before the brain is developed. It costs a lot less. yes, the findings are better. It's just a lot more effective, and I'd love to talk with you more about that. Senator Sobel asked me to talk about early childhood development with quality child care. And so what kind of world do we want for our families? It all starts when they're little. And I love this trajectory because it shows the green line is a healthy trajectory, the yellow is an at-risk trajectory, and the red is delayed or disabilities. And we know the factors that push kids down from a healthy trajectory to be at risk. Those are poverty, the lack of health care, and trauma and toxic stress. We also know the protective factors and the interventions that can take kids who are delayed and to push them into a healthy trajectory. And the most effective time to do this is in the first 1,000 days, the first 3 to 5 years of life. And we know that a lot of our kids in Florida could benefit from high-quality child care. We have more than 1 million kids in Florida that are under the age of 5. The poverty rate is 27% for kids under 5, but it's 53% for kids 0 to 3. So we know that our most vulnerable kids are also the most impoverished. And those numbers are different because there's under poverty and there's at or near poverty. However you look at it, we've got a lot of kids that are impoverished. Of the kids 0 to 5 in Florida, we have almost 25,000 kids that have been maltreated by the time they enter kindergarten. And of those, about 17,000 were ages 0 to 3. I was shocked to read that 1 in 5 kids will have a mental health diagnosis by the time they're 5 years of age, and we need to do a much better job of identifying these emerging mental health problems when they're easy to fix, not when they're teenagers or adults when it costs a lot more and it's much more intractable. We also know that at school age that 1 in 4 kids will have experienced a trauma by the time they're in school age. So we have a lot of reasons why we want to invest in early childhood. One of them is this word gap, and I don't know if you've heard about it or not, but the 53% of Florida's infants and toddlers live in poverty. We know by age 2, there's already a 6-month gap between rich kids and poor kids in the number of words that they have been exposed to. By age 4, poor kids have been exposed on average to 30 million fewer words than a child in one of your families or our families. So there's this huge, incredible gap by kindergarten that these kids can never make up. The professional kids are reading their dad's iPhones and swiping them and playing Angry Birds. The poor kids don't even have books in their home. So making up this difference, it just sets a trajectory for failure. If we look at the maltreated kids, it's about 25,000 kids under 5 who've been abused or neglected. And we know that these kids are much more likely to have cognitive problems and speech delays and health problems and motor delays and mental health problems. But we also know that high-quality child care and early education can totally change the trajectory by the time these kids get into school. For many years, I was at the University of Miami at the Mellman Center for Child Development, and we had a program there called the Infant Health and Development Program. And we had kids who, these babies were there, and their mom didn't want them, so she didn't touch them the whole first year of life. She left them in the crib. They had what we call inorganic failure to thrive. Their head circumference actually decreases from neglect. You can see the PET scans of these kids, and the one on the left is a healthy child, and you see their prefrontal cortex, the round part at the top, being very red, meaning it's very rich and developed. If you look at a neglected child, their prefrontal cortex is not developed. developed. And so what is developed is their amygdala, the bottom part, that is really the emotional, the flight, fight, or freeze part of the brain. So they learn very early on to fight for things, to run away, or to freeze. So what we did at the Merriman Center was to take these kids and to give them this enriched quality child care. And it was a longitudinal project. It was at 8 different medical schools across the country. And not only was there a difference by age 3, we followed them, the Robert Wood Johnson program followed them till they were 18, and there was still a significant difference at age 18. James Heckman, who is a Nobel laureate economist, did this economic model, and he shows that the greatest rate of return is when we invest in the first trimester of pregnancy or in the pregnancy period. The least effective is later on. These kids at the Melman Center, we had a reunion last year, and they came back. So these were the little girls. They were premature, low birth weight babies. The last time I saw them, they were age 3, and now they are age 26. So, and there are preschool teachers in Miami. So not only do we have the data that shows that these kids do well, we also know from personal experience that it really makes a difference. This is the Abecedarian Project. We know that we've studied these kids now till they're 35 years of age, and we know that when you have high quality early education, it increases IQ, it increases their reading, they're more likely to go to college, and then it decreases the bad things like grade retention and special ed and teen pregnancies and depression. So what makes a high-quality child development center? These were all from our Miami project, which has now been 26 years ago, but the components of quality haven't changed, and you can only imagine there are small groups with well-trained teachers, low adult-child ratios. I had 16 2-year-olds in a room one year, and I decided that that's too many kids in one room. So having a low adult-child ratio, engaging the parents, and then having an enriched learning environment. So for the past 10 years at FSU, we've been working on trying to define what is quality, particularly for infants and toddlers, because a lot of people feel like it's just babysitting, that it really doesn't matter. But we know now from the brain development, we know from these research studies that what happens early does have a longitudinal effect. We know that staff well-trained are one of the most important components, and that if we hadn't had well-trained teachers, they might have not turned these kids around. We know that this little boy in the bottom, he bit 27 times one day. Well, we found out that both of his parents were in jail. He lived with an elderly grandmother. He was 2. He didn't have the words to say, my emotional needs are not being met. All he knew how to do was to bite. And so we started giving this kid lots of attention and enrichment, and guess what? His biting stopped. But now we have these policies, these no tolerance, so we kick those kids out rather than trying to understand what's the trauma that's going on that's causing the behavior problems. We also know that the most pivotal component of is the relationship between the caregiver and the baby. And I think it's analogous to dandelions. Dandelions will grow anywhere, and most kids are like dandelions. They're going to do well just about anywhere. I like this pyramid because it shows that 80% of kids are going to do well if they have nurturing relationships and high-quality environments. But about 15% of kids are going to need some kind of support, and about 5% of kids are going to need intensive interventions. And these kids are like orchids. You they're fragile, and they're going to need a specialized interventions or hot houses. They're going to thrive, but only under the right circumstances. And if kids don't have the quality nurturing parents and high quality environments, then this pyramid is inverted, and you're going to have a lot more kids needing more intensive services. So it costs a whole lot less, and for society, when we do a good job on the bottom, then we need a lot fewer intensive, more expensive services on the top. But if we look at the state of child care in Florida, we are ranked 40th lowest in the nation. That's like out of 50. We have no group size, so this is a picture from Miami where there are 200 babies in one big warehouse, and they are licensed because we're one of the few states that doesn't have group size limit. We don't require a diploma or a GED, so you can be 16 years old, like they're referring to, and take care of children. We don't require pre-service training. Manicurists require 1,000 hours in order to get your nails done, but we don't require pre-service training for our child care workers. Our ratio for toddlers, that's a 2-year-old. Have any of you been with a 2-year-old? We thought about bringing 11 of them in so you could just see what that might be like with one adult is the ratio that we have for 2-year-olds. We also require no background check for child abuse or sex offender registry, so you can actually abuse your own kids and take care of other people's kids. We require some background check for directors, but not for the frontline people that are taking care of the kids. We also are one of only 8 states who doesn't have a quality rating improvement system. Several of us went to a national meeting this year. There were 800 people talking about a QRIS system. I didn't even know there were 800 people who knew what that meant. But the other states are way ahead of us. And if we look at, this is the comparison, the black graph are infant toddler centers, the red graph are 3 to 5-year-olds. And what you see from this chart, and these were 6 national longitudinal studies, is that good quality is a 5. There's a rating scale from 1 to 7. 7's an excellent, 5 is good, 3 is minimal. If you look at this across the country, we are not even meeting good quality, and infant toddler care is consistently of lower quality than 3 to 5-year-olds. And Phyllis Khalifi did a study here in Florida looking at Gold Seal programs versus non-Gold Seal licensed programs, and she too found that the infant toddler care was of much lower quality than the 3 to 5-year-olds. But what she also found was that the Gold Seal programs were of the same minimal quality as were the non-Gold Seal. And in Florida, we invest in Gold Seal programs. So we give an additional rate, a supplemental daily rate to programs that we call Gold Seal. And you all spend $33 million a year giving this extra supplement. But what we found is that overall the quality of the non-Gold Seal programs are equal to the Gold Seal programs. And 12% of the providers earning the enhanced rate were so poor that it could be considered harmful. So part of the problem is the accrediting agencies. Of the 11 approved accrediting agencies, only 4 of them demonstrated better quality than non-Gold Seal programs. So we really need to look at what is this accreditation and align it with quality, because we do want to reward programs that have higher quality, but we want to make sure that's the case. So Florida has a huge opportunity in the reauthorization of the Child Care Development Block Grant grant. And it requires, the feds are requiring things that frankly we as a state have not had the appetite to take on in terms of quality over the past years. So in order to get the money, which there are people who know a lot more about it than I in the room, it's a whole lot of money for our subsidized child care. So in order to do that, they are requiring that we have standards for group size, that we have a limit, that we have child staff ratios, that we define qualifications for providers, that we have training requirements, that we have better health and safety and background checks, and that we have a state advisory council on early care and education. They also suggest that we prioritize high-risk children, like children in child welfare, and that we have considerations for social, emotional, and behavioral health. And note that this only pertains to subsidized child care dollars. We have other dollars that are spent for child care and pre-K that these don't apply to, but we really believe that all licensed child care should have some of these basic qualities. So a couple of years ago, there was a statewide work group. Senator Sobel, did you bring the study? You all have it. I don't know if everybody has it in their packet, but it was a statewide work group that Tana Eberly from the Children's Services Council in Palm Beach chaired. Judge Cindy Lederman, a bunch of distinguished authorities in early childhood were part of this work group. It was 2011. They made a number of recommendations that have not been implemented that are still very valid. They're based on national standards, and so if we were to do that, we would do things like have criminal background checks of all child abuse and sex offenders for all of our staff. We would have a minimum age of 18 with a diploma and GED required. We would have a minimum of 20 hours of pre-service training and 24 hours of in-service. We would have a 1-to-8 ratio for toddlers, or we would have much better ratios than we have. We would have group sizes that would be limited, and we would ensure that each lead teacher had a minimum of a Florida staff credential, which is a child development credential. We also would reinstate the State Advisory Council. We would have some kind of plans towards a quality rating improvement system in Florida. We'd reassess the criteria for Gold Seal supplements to align better with quality. We would incentivize social emotional screening support so we're not kicking out 2-year-olds that are biting. Rather, we're trying to understand what's the underlying trauma that's causing that behavior. We had a 5-year-old in St. Pete that was handcuffed and arrested by 2 policemen for having challenging behavior in the classroom because the teachers don't know what to do with them. So we're criminalizing these emerging behavior, mental health issues because we don't have teachers who are trained and have the support. And we'd also do something innovative on closing the achievement gap for at-risk kids. We'd love to see some kind of enhanced rate for programs that have better quality, that have trauma training, that have access to mental health professionals, so that we can really meet the needs of the poor kids, the kids that are maltreated, that we can meet their needs when they're most receptive, when it's easiest to change, and when we get the most bang for the buck. And so we would use the quality dollars to provide enhanced rate to quality centers that are serving high-risk kids. And James Heckman, who was the Nobel laureate, said that the highest rate of return in early childhood development comes from investing as early as possible. Starting at the age of 3 and 4 is too little, too late. Effort should focus on the first years for the greatest efficiency and effectiveness. So these quality improvements are going to require a bigger investment. But the economists tell us that this is the best place to put our investment. You might consider something like a Brighter Futures Scholarship, where in addition to Bright Futures for College scholarships, that we might have even brighter futures if we invested in these kids when the brain development is most amenable to change and improvement. So what I would like to invite you to do is to visit the child care centers in your community or here in Tallahassee. We'll set up the visits for you. I'd love you to see the differences in quality programs and non-quality. These are all licensed programs in Florida in this picture and they, as you can tell, vary widely in quality. So we'd love to have you see it firsthand for yourself. So in summary, we know that quality child care can change the trajectory. By age 5, we can change what's going to happen for these kids, whether it's being in school or whether it's being in DJJ. This morning I was over in Jacksonville training for Judge Gooding. We had 400 people there talking about baby court this morning. He told me that in his delinquency court that 9 out of 10 kids in his delinquency docket come from DCF. We are creating a pipeline from DCF, the kids that we are abusing and neglecting, and they are going straight into the DJJ system. We have an opportunity to change this in early childhood. Thank you so much.
Okay, Senator Garcia, you're on. You had a burning question or thoughts?
A burning question.
Thoughts.
And thank you, and I thank you for the presentation. And I appreciate your passion for children, and I think it's evident in how you present yourself. But how do we get past, and we have all these statistics, but how do we get past the fact that as a society, we value more? And I say this, I don't have to be tread very lightly here, but when something happens to an animal, society comes out and in an uproar and say, oh, how can we do this to this poor animal? And yet when something happens to a child, we as a society have been so desensitized that that is someone else's problem, or it's someone else's neighborhood, someone in some other neighborhood. How do we turn that corner where we can come together at state, let me break it down, as a county or as a city, where we start valuing our children and that valuable resource more than we do today? Because we can have all these presentations and we have all these numbers, and since I've been in the House, it's been an uptick. Every day there's more and more and more problems with these children, and we devalue children more and more every day. And then people like yourselves that are out there every day fighting more and more to try to change that divide. What can we do to start and changing that or turning that corner? And the reason I say this is because, I realize now, when I've taken on the issue of mental health, that the biggest problem that we have in mental health is the stigma associated with mental health, and no one wants to talk about it because it's someone else's problem or it's my problem, and I just don't want to talk about it. And this committee has done a great job, and thank you for the work that everyone here has been doing. But now when we take the issue of children, it's the same concept. What can we be doing? What can we do more to turn that corner?
And how much time do you have?
Maybe we can get together and talk.
I would be happy to, but the short answer is we've got to get upstream on this. And one of the things that is a bright light is the new focus on baby court. And what we know is if we heal the trauma of these children coming in the system and also concurrently heal the parents' trauma, then we can stop the cycle. We are seeing incredible results with the pilots that we've had. Half the days in the system than kids who are not in this baby court, which is really therapeutic. Almost all these adults that are maltreating their kids were the abused or neglected child 20 years ago. Now they are the parent, because we never healed their mental health issues. We never addressed their trauma. When we heal it, we can change the trajectory. Maybe not for all of them, but for a lot of them, and it's very encouraging.
And what happens with it, Madam Chair? what happens with a child if we put all these resources and these programs into these great child care facilities or educational child care facilities? What happens? Is there studies that track what happens to a child when they go home and they're not receiving that same love and attention and follow-up that they are receiving at these facilities? What happens at that point?
The research shows if you have one caring adult in your life, that can buffer the trauma and toxic stress that you receive, whether that's a caring person at home or a teacher at school. That one person can make the difference in how kids cope. And so we can't fix it all, but what we can do is make sure that each kid has one caring person, whether that is at home or school. And we're very encouraged by a lot of the early childhood work that's happening around the country. It's really changing the trajectory, and I'd love to talk with you more about it.
And I appreciate it, and I think everyone in this committee feels the same way. But it's just a little frustrating at times when we see what happens. Listen, I'm going to break it down to Dade County. I see it in Dade County all the time when I have conversations with individuals and elected officials when they'll say, well, that's not my problem, that's someone else's problem. And I think until we don't start talking as a community and realizing that these children are the ones that are going to be taking care of us, you know, we can throw all the money at it you want and all the programs you want at it, but until we don't start making it serious and making it a priority, it's just a little frustrating. So
there's a movement to have trauma-informed communities, and we have 3 in Florida so far. We'd love for Miami to be another one, but we're the whole community, like in Gainesville, the law school, the med school, the social work, and the whole community's coming together and saying, how can we be a trauma-informed community? Because it takes the schools, it takes the policemen, it's really everybody coming together to say it's all of our jobs. It's not just DCF's job, or mental health is not somebody else's responsibility. It's all our responsibility. So it seems like there's a lot of enthusiasm and momentum around these trauma-informed communities.
Any other comments, questions?
I have questions still.
Senator Allman?
And I agree. I think these are incredible, and that's why I was so curious about the specific needs. And I assume healthcare obviously is a big need. Screening for mental health problems for very young. Did the Children's Cabinet look at the negative impacts to care to children that are created by the state not expanded Medicaid? I know the CHIPS program and the Affordable Care Act are providing significant additional resources for children in those first 1,000 days or even earlier, and by not expanding Medicaid, we've deprived a lot of coverage for those young kids. Did the Cabinet look at that?
We made a proposal to the Cabinet that had 5 priority areas, and they're in your packets if you'd like to go over them. And one of them was ensuring that each child had a medical home, and they had developmental screenings, mental health screenings. We can detect mental health issues at 18 months of age. So, you know, we have the opportunity to look at these emerging problems, and having the health care would be a huge part of it.
Thank you.
Any other comments, questions? Well, I'd like to weigh in a little bit. First of all, I believe that with developmental disabilities, the earlier you start, the greater the prognosis. There are many kids in the child welfare system that have developmental disabilities. Have there been studies that you're aware of that have shown that the earliest intervention helps?
Absolutely.
Okay, so we know that. So all of this is multidisciplinary. It involves mental health, disabilities, education, health care, social interaction. To have change here by the Florida Senate would involve many committees, not just this committee. We have one aspect of kids under child welfare, those kids in the system that need help very early, and the parents as well. We need the education committee. We might need the criminal justice committee. Is there any other we would need the Appropriations Committee, and the Appropriations Committee chair just happens to sit on this committee. You talked about incentivizing and using quality dollars. How could we increase quality without spending dollars? Is there any way to do that?
Well, there's something called tiered reimbursement. There are lots of incentives that other states have used, the STAR systems, where, if you are a 5-star program, you get a higher reimbursement rate than others. It's getting the child care community on board with that. But yes, there's certainly ways, and perhaps you'd like to have a group to make some recommendations about that. There are folks that have spent a lot of time looking at those issues.
I think that Senator Garcia's committee would be the one to look at if we set up certain higher standards for this state, and we want to be proud of what we're doing, that we would set up some incentivized system that would give higher reimbursements to those quality, like more of a carrot than a stick.
Absolutely.
So if we could do that, the ball will be in your court. We've talked about this forever. I believe we talked about this when we were in the House. We've talked about this, all of Nancy, Senator Dean's been in the House. We've heard about early childhood. And Senator Garcia was in the Senator Orton was in the House. We were all in the House. We've heard this. This is like broken tape. It's the tape keeps going on, and we haven't accomplished what we need to do. So I'm willing to work hard, if this committee's willing to work hard, to make something happen at this particular time, because we have a lot of good people out here who are willing to put forth the effort to get the kind of legislation that we need that would improve the quality of child care, to break the cycle of welfare, child welfare. We keep reading these CERT reports. I get them, and I don't know if these parents could be helped with multiple services. But if we had gotten these kids at an earlier age to have that one caretaker who loved them, who spoke to them, who played with them, who developed their vocabulary, their brain might have developed a little bit differently for the kids, and there might be a different kind of performance. So there is hope. There is hope here. And we have to look at alternatives.
Also, child care is a protective factor against more maltreatment. So while they're in care, it's true. It has multiple benefits.
We were just talking about the Relia Wilson Act, that you have to make sure they're in child care, and we even, I think in 1666 we lowered the age. We lowered the age for kids to be in child care. So I thank you for all your very good work, your great presentation.
Thank you so much.
And I know your 1,000 days is really important, and if everybody would look at it in the backup, we could, and if you want to comment or see what we could do, that would be great as well.
Sure. In your package, you have the presentation that was presented to the Cabinet about the first 1,000 days. There are 5 policy recommendations, and the first one is quality child care. And what we know is that 62% of moms in the workforce have an infant, and yet we have very few quality and or accessible infant care. So women are really struggling, or they leave the baby with a boyfriend, and then we have child deaths, and so infant care is of particular concern. It also is very expensive at a time when people don't earn very much money, so it's a real issue. So our first policy recommendation is to expand affordable and high-quality infant-toddler care and to improve the quality of all child care. The second policy recommendation was to expand eligibility and to maximize the impact of early intervention intervention. We know that when we get kids early, that's we can have a much, as you were saying, Senator Sobel, have a much greater impact on their development. And yet, Florida's eligibility for early intervention, we're only looking at 2% of the eligible kids. So you have to be 2 standard deviations below the mean to qualify, which means that 48% of the kids who could qualify don't. So we've got kids who could benefit from early intervention who are not getting in. I was at the Debbie School for years, so we had kids who are at risk. If the kids are just a little delayed, you can get them to be in the normal range much easier. Right now, we only take the kids who are the most serious delayed, and so we're missing all these kids that just with a little bit could, you know, be in the normal trajectory. So we'd love to see the definition expanded for early steps of what kids could benefit. The third recommendation is your point, Senator, that all Shashuran families have a medical home and promote the utilization of mental health services, especially for infant mental health and depression. Then the fourth recommendation is to improve the outcomes for infants and toddlers through initiatives such as Baby Court, where we have 28 judges across the state that are implementing Baby Court, which is bringing mental health and therapies into the courts to address both the parent and the child. It's making a huge difference. And then the last policy recommendation was to support economic policies that will help families, like job training and family-friendly businesses and flex time and family leave, so that families can take off when they have a baby. The majority, I read something the other day, something like 60% of women only take off 2 weeks when they have a baby and they are back at work. And that's not good for the women. It's not the optimal for the baby. So what can we do to support tax incentives and tax credits and family-friendly businesses that would really help families more? So those are the 5 policy recommendations for the first 1,000 days. The Cabinet has a policy group that's looking at those and what are the ramifications of them. So we would love to have your support in helping us promote this. I just saw First Lady Scott this week, and she told me that they are expecting their 4th grandchild. And I asked her if she knew about the first 1,000 days, and hope that she too and the governor would get on board with the first 1,000 days, because everybody loves babies, and if we can do a much better job doing that early childhood piece, we'll have a lot better grown-ups.
Thank you very much.
Thank you so much.
You want to say one thing?
Just real quick, when would you take on the issue of the zero tolerance policy that we have in our school system? Because we keep on seeing it. I think that's a problem, that we see children are being suspended and kicked out of school for the dumbest little things that every single one of us in this room, well, I say you guys, but I did, and I didn't get kicked out. So when are we going to start addressing, is the Children's Cabinet, are you all going to start trying to address that issue or give some recommendations to the legislature so we can address those?
I can't speak for the Children's Cabinet, but we are, there is a movie we saw this week in Tallahassee. It's called Paper Tigers. It's a documentary about how a school in Seattle turned their school around when they understood, when they became a trauma-informed school. And we had our superintendent of schools here, we had the chief of police, we had Judge Shorstrom, and so we had this multidisciplinary team look at how can we look at the trauma, so we're not just expelling these kids who are just, getting deeper and deeper, and how can we address their mental health needs and their trauma. So there seems to be an enthusiasm and an appetite for looking at things differently and looking at the mental health issues. Not fast enough, but if you have some suggestions, I'd be happy to help push it forward. But I can tell you that the viewing of this documentary has started the conversations in many communities. It's also going to be in Miami in a couple of. I can tell you when it is in Miami. I know they'd love if you would come and help start the conversation for how we go about changing it.
Okay, Senator Hudson, you want to say? By the way, Senator Hudson was in the House as well, I think. So everybody here has been in the House. Did you take up early childhood issues there as well? How many engage you?
He's married.
Madam Chair, yes. Briefly over in the House, I sat on the Children and Families with Rep. Harrell, so we discussed it as before I transitioned over here.
Okay, good. And I want to recognize that you are aware of this as well. We're all aware of this issue. It's time to do something. That's really what it's about. And I really appreciate your presentation. I know you've synthesized it and summarized it, and there's lots more reading. If you want more reading, we definitely have a lot more backup if anybody's interested. And again, thank you very much. And if you want anything on the Children's Cabinet agenda, I believe you should speak to Wansley Walters, Senator Garcia. She's the executive director of the Children's Cabinet.
Great, thank you.
Thank you very
Madam
much.
Chairman, I just want to echo fantastic presentations, and I think as we look at where we need to prioritize, this would definitely be one of my areas. I think I'd vote for that first 1,000 days. It's a tangible, measurable, definable strategy that, from the data, provens that have returns.
The return on investment,
Yeah.
and I thank you for your comments as well. And let's get to, as it says, let's get to work. And at that point, anybody else want to say anything? Vice Chair Allman moves we rise. Thank you.